So we have our very last presenter. We have Brenda Walker, and she is here from Dentaquest. So just hang in there. This is our last one here. Thank you, Brenda.
Hi. Thank you, Dr. Lackabouffer, and to HHSC for having us here today. I'm Brenda Walker, Regional Director for Provider Engagement for Dentaquest. I want to thank all of you guys for coming out today as well. I have a lot of stuff to talk about. Some of this you guys have heard it more times than a few. Some of it's going to be brand new, so I'm going to try to pay attention to the things that we really want to make you aware of. Credentialing is always a big subject, so we want to let everyone know, as a reminder, we're having trainings on this program monthly. We do have an electronic credentialing tool called App Central. We encourage, if you're credentialing a new provider, to go through App Central, and we want you to use it for certain reasons. It's document storage. Once the document is loaded there, it stays there. It will not get lost. It also updates you on your status. If you fail to submit a form, or if something's incomplete, or if we need something from you, it's going to continually bug you via email that we need that information. It'll also give you any notification of missing items, and we want you to use this because pretty soon, by the time hopefully when we have the next big recred, we're going to be using it through App Central, and we're going to be asking that everybody do that because it's just a lot more efficient. Another thing that we're very excited about is the member portal. In the very near future, we will be launching a secure, HIPAA-compliant member portal. We're very excited about this. We're going to be talking to the providers. Even though it is a member portal, we want to let you know because we're going to be asking you to help us drive members to using the portal. They'll be able to make main dental home changes directly on the portal, and the portal is real time. So if they're standing in your office and you have to make that change is going to be automatic, and you're going to be able to see it on your portal. Another good thing about this portal is that it is going to be a mobile app as well, so they can do it on their smartphone. They'll be able to get a replacement ID card. They're in your office, they've forgotten left their ID card at home, they'll be able to pull it up right there and go, here it is. We'll be able to communicate with them reminders, and we're also working on technology where you as the provider will be able to communicate with them as a community to send them reminders of their appointments, those types of things. And once again, I just want to say it's all secure. Provider portal. This is one that I'm really excited about, and this comes about after 4 years of notes from the provider community. We will be launching a brand new provider portal sometime in the very near future. I want to say that this portal, we're not just going to put something out there. We have taken all of your feedback since I've been with the program in 2012, and we have initially built the framework of what we heard that you wanted. We're working on that right now. Once it's in a testing phase, we will be pulling in our provider advisory committee. We'll be including TDA, we'll be including TAPD, and we will be using them as the test group for the portal. So we're going to let them get in and use it, give us feedback. Hopefully if there's any glitches or anything that goes wrong, we'll have time to fix it, and then we'll be making enhancements based on their feedback. We have two groups of things that we're doing. We're doing needs, things that we know you guys need, and we're also trying to give you some of your wants, things that you want. Needs are always going to be first before the wants, but we want to get some of them in. So some of the things that we want to provide in the provider portal is reporting functionality. We have providers all the time come to us and say, can you tell me what code what's the highest percentage of denials for me? We want to give them the intelligence and the capability in the portal to where they can go in and pull reports that are tied to their specific practice in the specific way that they operate. Also, main dental home adds and changes. We want to provide you with real-time alerts anytime a member is added to your office, and also anytime a member changes from your office. That information would come through to you. It would say, this new member has been added to you, he's chosen you, he's been added, or however he got to you, or you're going to get an update that says this member just changed their main dental home, you're no longer it. We're also going to enhance the claims and appeals process. We're looking at doing reminders. An example of some of those reminders may be we're looking at your new members and it's 45 days out and we haven't seen any claims history come through. We may send you a reminder with that list of members saying, please remember to contact these guys and get them in for their checkup. They're new. Also, green communication. We want to be green in 2016. We really do. So any things that we're sending to you now via paper, whether it be your incentive report, whether it be your scorecard, whatever it may be, we want to be able to just upload that up into your portal and send you a notification that it's there, and then you'll be able to go out and retrieve it. And again, secure access. The other thing we're trying to do is, hopefully you guys will be excited about this, the internal care transfer process is going to be a two-way communication stream between the provider that is currently treating the member and the provider they need to send them to. And the way that's going to work is what we're working on is that once you do an internal care transfer and we approve it, not only would you get the notification, the member would get a notification, and the provider you're sending them to would get a notification. So everybody would be notified electronically, and it would have the ability, for example, if you have notes or if you have Xrays that you need to share with that provider that you're referring your member to, you'll be able to upload that into the portal, and when he gets his transfer, he'll be able to go in and pull that documentation down. So that's one of the things we're excited about. And the last thing I'm going to get off the portal, as you guys can tell, I'm pretty excited about the portal. But we're looking at cafeteria style, really custom user access. And I know I have one provider in the room that's been asking about this for 4 years, so hopefully she'll be excited. But when a super user goes in and sets up another user, they will really be able to go to a pick list and choose what they want that person to be able to see. So if they have someone in their office and the only thing they want them to do is be able to look up eligibility, they'll grab eligibility, drag it over, click, and that person will only be able to look up eligibility. So we're really excited about that because right now we kind of have a tiered process, and it's like if you're tier one, it's at all or nothing. Well, we've decoupled all of that, and you're actually going to be able to choose exactly what you want them to do. Middle of last year, we implemented our provider quality program. Actually, we enhanced it by bringing on Dr. Gregory Stout, and Dr. Stout's in the back of the room. Many of you may have seen him. Dr. Stout, if you can raise your hand or pop your head up. Dr. Stout is our quality dental consultant, and Dr. Stout plays a big part in the overall quality program. With Dr. Stout came the provider quality scorecard that many of you see. We distribute that quarterly, and what it shows you is where you compare to the providers in your region, the providers in the full network, and towards your yearly quality target. And we send that out on a quarterly basis. And it's pretty closely tied to the incentive program, which we do on a quarterly basis as well, and it's on preventive measures. Just a few reminders. The 2016 CDT Code update, the new codes as of January 1 were D4283, 4285, 9223, 9243. The only thing I really want to say on this screen is that currently right now 4283 and 4285 are paying at zero. 9223, 9243 are paying at the current rate, which was $35. As soon as everything is cleared up from the most recent rate hearing was held, then we'll go up and establish what our rates are going to actually be. We'll notify you guys and we will reprocess all of the claims, so nothing is due on your side. Okay, we'll go back to January 1 and reprocess all of those claims. The interim care transfer process, I know most of you are pretty familiar with how this works right now. Basically, if you're a main dentist and you're sending your patient to a specialist, not counting a pediatric dentist, but he's going to an oral surgeon or anything like that, or prosthodontist or endodontist, there's nothing needed. But if you're sending your patient to another doctor that classifies as a main dentist, which would be a general dentist or a pediatric dentist, and they're not within your brick and mortar, you would need to do the interim care transfer form. Okay? Like I said, what I'm really excited about this is in the very near future, this will all be done through the portal, and all parties will be notified, and you guys won't have to use that nagging phone call to make sure there's one on file. Also, what we think is going to happen once we do that is that providers will be more likely to do what they need to do because it's going to be easier for them. And so we want to make this easier for everybody overall. Right now, you have to fax the form in, and you have to call in to find out it's on file. So it's a pretty tedious process, and we just want to simplify that and make it easier for the providers. Most commonly, administrative denial reasons, service exceeds benefit limitations, or maximum benefit allowance. In other words, it's a 564 if it's CHIP. They're already at 564, and you didn't submit anything for authorization. We're going to deny it because it's exceeding the 564, or they're getting a service, maybe a cleaning, and it's not time for them to have another cleaning, and you didn't submit it under EPSDT, so we have nothing to look at to determine why you need that cleaning, so we're going to deny it because it's outside of the benefit limitations. Submitting provider is not the primary care dentist. Procedure is a duplicate. Patient simply not eligible, they don't have Medicaid, or the procedure has been submitted after timely filing. So just remember that timely filing is within 95 days from the original date of service, and anything outside of that 95 days from the original date of service, you have to appeal that claim. It can't just come back through as a resubmission. It's going to deny for timely. Clinical denial reasons. For CHIP, really CHIP and Medicaid, there's no narrative supporting what you're asking to be done. On CHIP, you have to prior authorize anything over the 564, and it's important that you let our clinical team know what's needed. So you have to give them the whole story. Crown's tooth does not have extensive decay or multiple surfaces or moderate cuspal involvement. For crowns, if no pre-op radiograph is provided, pre-op and post-op are required. And then on third molar extractions, we have to have a narrative, and we have to have a reason for the reason those teeth are needing to be taken out. You can't just say they're in pain. All 4 teeth hurt, they want them out. That's probably going to deny. On submitting X-rays, we prefer electronic. We do use NEA, and you can submit those on the provider web portal. If you're mailing X-rays, make sure they're duplicate and make sure that we can read them. Send them in, send the originals. You can send originals with the ADA claim form. If you want them returned, you need to send us a self-addressed stamped envelope. We do prefer that you send duplicates, but make sure, like I said, that they're legible, that they can understand them and read them. They should always be mounted. If you're sending in 4 or more unmounted X-rays, they'll be returned. We need to be able to know exactly what we're looking at, so make sure everything is organized. They need to be good diagnostic quality, dated, preferably with the member name. So if something gets separated, we can kind of easily put it back together. Like I said, we can't return X-rays if there's no self-addressed stamped envelope. So if you want them back, make sure you send us the envelope. And you need to refer to the ORM on the benefit tables because they will tell you whenever X-rays are required. And that's basically it. For additional questions, you can contact, this is the number for our Medicaid and CHIP provider hotline, our member hotline. We also have a separate CHIP hotline. And I think everybody in the room, when you guys want to find me, you don't really have a problem. But I'll be here at the end, and if you have questions, please don't hesitate to ask.
Okay, thank you, Brenda. Appreciate that. Okay, so this basically concludes our presentation of all of the people that are involved. And that was one of the things that I wanted to, thank you, Brenda, wanted to just reiterate again, all the different people that are involved in making this Medicaid program work.